All right, we're about to dive into two really critical but completely different moments in breast health. One is an urgent, painful infection that needs a fix right now. The other, it's a silent, hidden risk that could totally change someone's future. So how do doctors make the right call in each of these situations? Let's get into it.
So you've got these two scenarios. On one hand, a new mother dealing with a really painful infection. And on the other, a healthy woman who suddenly finds out she carries a high-risk gene. I mean, these are life-changing moments that need totally different, evidence-based game plans. Let's break them down.
Okay, first up, let's tackle the immediate problem, the one that you can't just wait on.
So picture this. We have a 42-year-old woman, she's a new mom, and she comes in with a classic and very painful problem, a tender, swollen, red, warm area on her breast. An ultrasound confirms it's not just a simple infection, it's actually become an abscess.
So what exactly are we talking about here? Well, a lactational breast abscess is basically a walled-off pocket of pus that's formed inside the breast tissue. It's usually what happens when a breast infection, or mastitis, doesn't get fully cleared up. And believe me, it is incredibly painful and needs very specific attention.
And this brings us to the big question, right? If it's an infection, why not just hit it with a strong round of antibiotics? I mean, it seems like the most logical first step, but in this specific case, it's actually not the right call. Let's look at why that is. Here is the key difference. Antibiotics, they're fantastic for fighting an infection that's moving through your tissue. But the moment the body builds a wall around that infection and creates an abscess, the game changes. The drugs just can't get inside that little fortress to do their job. That pocket of pus is totally shielded, which means the root of the problem is still there.
Okay, so another idea that seems to make sense is to stop breastfeeding from that side, to let it rest and heal. But, and this is so important, it's actually one of the worst things you can do. Stopping the milk flow creates what's called milk stasis. Think of it like a traffic jam. This just builds up pressure, makes the discomfort worse, and can actually make the infection much harder to clear.
So, the most appropriate treatment is this two-step combo. It's absolutely crucial. First, you have to get that pus out. A doctor has to either make a small incision to drain it or use a needle to draw it out. Second, and this is just as important, the patient has to keep breastfeeding. This keeps everything flowing, prevents that traffic jam, and is literally part of the therapy. It helps the breast heal so much faster.
Now, let's totally switch gears for our second case. We're moving away from an immediate physical problem to a silent genetic one that's all about the future. So here we meet a 48-year-old woman. She feels great. She's perfectly healthy. No lumps, no pain, zero symptoms. But her family has a significant history of breast cancer, so that prompts some genetic testing. And the results? Well, they change everything.
She tests positive for a BRCA1 mutation. Now, it's so important to understand what this means. This genetic mutation isn't cancer. It's not even an illness. What it is a statistical bombshell. It means her lifetime risk of developing breast and other cancers just went way, way up. The question isn't about treating a disease she has, it's about preventing one she might get.
The stakes are incredibly high, but the potential solution is unbelievably powerful. For a woman with this BRCA1 mutation, a preventive, or prophylactic, double mastectomy can cut her risk of getting breast cancer by more than 90%. That is a staggering number. It almost completely wipes that specific risk off the board.
So when you just lay out the options, the path becomes really clear. Just watching and waiting? That's just not appropriate when the risk is this high. A medication like tamoxifen can help a bit, offering moderate risk reduction, but it's nowhere near as effective for someone with this mutation. When you're facing this level of risk, the prophylactic mastectomy stands out as the single most effective way to prevent the cancer from ever showing up.
So what do we learn by putting these two very different cases next to each other? Let's boil it all down to the key clinical takeaways.
Really, the big lesson here is about targeted intervention. For a physical problem like an abscess, you need a physical solution. You've got to drain it. And you have to work with the body's natural processes, like breastfeeding, as part of the cure. But for a future risk that's written into your DNA, the most powerful intervention is just as direct. You remove the tissue before it can ever become a problem. They're two totally different paths, but they have the exact same goal: protecting health with decisive, evidence-based action.
And all of this leaves us with a pretty fascinating question to think about. I mean, that second case, it was impossible to even diagnose, let alone act on, just a few decades ago. As we get better and better at reading our own genetic blueprint,
We're shifting from an era of just treating diseases to an era of proactively preventing them based on our own biological code. You have to wonder, how is this knowledge going to continue to completely transform medicine and the choices we all face?